Hi, everyone. Good morning. Today, we're joined by Dr. Brandon Webb to give our weekly COVID-19 update for the state of Utah. Dr. Webb, it's nice to see you. Thanks for joining us.
Good morning.
Good morning. So we're going to start, as always, with case trends and go over what's been happening since the last time we spoke. The total case counts in the state of Utah are 361,756. And yesterday's daily case counts were reported at 462, which brings our 7-day positive rate to 13.9%. Our deaths total in the state of Utah is 1,796, with 2 reported yesterday. Our hospitalizations that are a total at 14,209, with 274 reported yesterday. And our vaccines are at 525,033, with 364,224 people receiving their first dose and 160,809 receiving both doses of the vaccine. Let's start there. Let's go over case trends and how we've been doing. These seem to be a lot lower numbers than we've had in the past. What does that mean for the state?
Well, it means that the state is doing the right things and that the community is pulling together. And I think it's important to recognize that right now our 7-day rolling average is right around 1,000, which is where we were in October. So, if we recall, in October was when we really started to see the fall winter surge, and 1,000 per day is still too high. But we're very pleased to see that these are coming down. And I think that it's a factor of 2 things. One is that people are doing a good job staying committed to social distancing and mask wearing. And at the same time, as we get more and more people vaccinated, and those are in addition to the number of people in the last 3 months, almost 180,000 Utahns have had COVID in the last 3 months. We're now starting little by little to see some population immunity. Now, we're probably somewhere just under 20% at this point, and that's a rough estimate, and it's not enough, but it is helping, and it's a very important thing to see more and more of the population immune, because coupling that with social distancing and the masking, it's driving our case counts down.
I want to quickly talk about how the state is now reporting case counts as well. They announced, I believe it was last week, that they're changing from test over test to person over person, which to my understanding means that if you're tested more than once, you're only counted as one person, as opposed to if you get tested 5 times, you're counted those 5 times, which could bring our positive 7-day rate down. Does this mean anything for the community? Should we be looking at this a little more carefully, or is this a more accurate way of actually reporting what's happening?
It's simply a more accurate way. It avoids the concept of inflating the numbers because people are being tested more. Each individual frequently are now in situations where maybe they've been tested. With the availability of testing, they need to be tested again, or they are part of a group that is being tested frequently, such as our college-age students, our high school athletes, and others.
That is a good point. A couple of weeks ago, we talked to the Granite School District around this test to stay or test to play. So the fact that it's now this person over person seems like it's going to be a lot more accurate, which is great. Another question I wanted to talk to you about is, so last weekend was the Super Bowl, and it's been about a week or so since that's happened. Have we seen any sort of surge from that normally gathering of people? And if we haven't, is that a good sign then?
Yeah, the numbers don't, at least to this point, don't show any type of surge that we would attribute to Super Bowl parties. We're still a little bit early to be able to say definitively that we didn't see a bump or a spike there. But I think the takeaway there is that as we continue through the late winter and into the spring, we want to continue to be vigilant about gatherings. And if we don't see a spike from Super Bowl parties, I think that that's a testament to Utahns being careful about gathering.
It is true. And I think it is important to note that people are doing a great job. Like you mentioned before, this is the first time we had under 500 cases in a day in a very, very long time. So it seems like we're moving in the correct direction, which is great. I want to talk about vaccines and just give an update. We talked about the number of doses that have been given out. How are we doing from a standpoint of speed? Are we moving at a rate that is good for herd immunity? What are we seeing in terms of how fast we're actually getting through to vaccinate the people who need it?
Yeah, I think if you look nationwide, we're doing quite well here in the state of Utah. I think that the governor's actions to really mobilize all of the resources that we have at the community level have paid off. We can't go fast enough. That's the bottom line here. We're actually in a situation where we're in a race between vaccines and variants of concern. And everything that we're able to do at the state level, at the Department of Health level, and as a community engaging in the vaccination process will pay off as we as a state try to get as many people vaccinated as quickly as possible so that these variants of concern don't have an opportunity to take seat.
Speaking of that, another question we just got was around the variants. Are we seeing any sort of impact with those variants, specifically in Utah? I know that a few cases have been reported, but has there been a significant spread of this variant that is going around?
It's hard to know because our throughput, even with the resources we have at the Utah Public Health Lab, which are more advanced than many states enjoy, even with that, our throughput is not to the point where we're able to do massive community-wide surveillance. So we're actually watching for signs and signals that we may be having variants in the community, like possible reinfection rates or failure rates. And by looking at those surrogate markers, we're looking for signals that we may be seeing more variants, even if we're unable to test widely for those. And at least at this point, we're not seeing strong signals that we have a dominating strain here in the state, but we're continuing to watch really carefully.
Have we learned any more about how much the vaccines actually protect from these variants, the ones that are at least on the market in the US? I know Johnson & Johnson's vaccine had some trials that happened in countries that had the variants, but as far as Pfizer and Moderna go, has there been any more data released around how effective they are?
Yeah, so we do have accumulating evidence that suggests that the two mRNA products have very good activity against the current predominant strain in the world. And against the UK strain, they also appear to generate good immunity. We also now know that the mRNA vaccines are less effective against the South African and Brazilian strains, but they are still effective enough that getting as many people vaccinated as possible, as quickly as possible, we expect will be an effective strategy for warding off these new variants.
And along those same lines too, I know that the clinical trials for these two vaccines specifically looked at symptomatic spread of COVID and whether you ended up in the hospital or not. Have we gotten any more data around asymptomatic spread and whether we can actually give someone COVID if we've been vaccinated ourselves?
So I'll make 2 points on that. The first is that we are seeing too many cases of acute COVID in people who've received their first dose. And what we know from the data so far is that you're not fully immune until you've had the full 2-dose series for those mRNA vaccines. And you have very little immunity for the first 2 weeks after receiving the first dose. And so, first point is we still need people with the availability of these vaccines, we still need people to be vigilant even after that first dose and through the second dose series. The second point I'll make is that we now have some evidence that from some of the other vaccines, including the AstraZeneca vaccine, which has been very widely distributed in places like Israel, we now understand that that vaccine generates immunity that is sufficient to decrease the viral numbers in patients, which means that having the vaccine makes it less likely that you could acquire and be asymptomatic and pass it on to others. But it doesn't give us complete confidence. And for that reason, we do need to maintain vigilance and keep doing the things that we know work, masking and social distancing. But it is encouraging.
And with that too, the CDC last weekend or this past week released information around the quarantine for someone who is fully vaccinated. They came out with the guidelines and suggestions that if you have been exposed to someone with COVID-19, but you're fully vaccinated, you no longer have to go into a quarantine as long as it's been within 90 days of completing that vaccine series. What are your thoughts on this? Do you feel like this is a good way and a good recommendation moving forward?
So this is a welcome change, and it reflects our purposeful and ongoing efforts to return carefully to more normal activity. What that means is that it now aligns those who have been fully vaccinated in terms of recommendations with those who have had symptomatic acute COVID in the last 3 months. And we anticipate that both groups, those who've been vaccinated in the last 3 months and those who've had symptomatic acute COVID, have enough immunity that if they are re-exposed, it's not necessary for them to quarantine in the strict sense. But it is still recommended that they watch for new symptoms, that they avoid high-risk activities, and it doesn't apply to some specific populations, including the nursing home population.
I also wanted to note that in that guideline, it also says after the 2 weeks of the second dose, which you just mentioned previously, that it does take some time for that immunity to kick in. And it also does mention the symptomatic portion. So if you are exposed to someone with COVID and then you happen to get symptoms, it's still important to then quarantine because you might have contracted it. Around that same lines too, we have also shortened the ability to get the second dose after you've had COVID-19. So before, it was if you got the first dose, contracted COVID-19, it was recommended that you wait 90 days until you get that second dose. Now they're saying that you can get that second dose within the 10-day period. Why is that? Does it change your immunity factor if you get COVID between the first and second and then get the second dose?
Yeah, that's largely due to our ongoing increasing understanding of how these vaccines work and potential side effects. There have now been well over 30 million doses given in the United States. And with those many doses, we're getting better experience, and we're working closely with the CDC to track adverse events. And what we're finding is that individuals who are vaccinated with the first dose and unfortunately then go on to have COVID-19 have sort of a natural booster, sort of like their second dose would serve to do. And if the patient is recovered and feeling well, it's generally safe to go ahead and have that second dose of the vaccine without overstimulating the immune system. So those guidelines are really based on accumulating understanding of the safety of these vaccines.
That's good to know. Another question we just got is around the snow and the fact that where we are right now, it is very snowy outside. Do you feel like this could potentially impact the number of vaccines and the clinics that are happening today? And if that does happen, are there plans to kind of push things off and to help people get vaccinated at a later date if they can't make their appointment, say today? And you might not know from an Intermountain perspective, but I guess just personal opinion on that.
Yeah, I think it's a great question. I'd have to defer to our Department of Health colleagues with respect to what their strategy is with whether I know that they're doing everything they can to make it as easy as possible and as streamlined for patients to become vaccinated.
And I would say on that lines that if you're worried about your appointment today, just check with your local health department, check on their Twitter and their website and see if they are changing anything based on the weather, just so you have that information before you head out if you cannot leave for some reason today. Another question for you around more so the case count. Someone wants to know if the demographics have changed at all for the people that we're seeing getting infected with COVID-19 and then ending up in the hospital as well. Is it still the same as kind of what's been happening over the last year?
Those who are hospitalized still tend to have the same patient characteristics. So the composition of the patients who go on to have severe disease and wind up in the hospital has been very stable over time. One thing that has changed slightly is that while we were in more of a surge phase, the criteria for admission to the hospital were changed to accommodate the massive numbers of hospital cases. And patients who, previously may have been cared for a day or two in the hospital are now increasingly cared for through telehealth and other remote patient monitoring programs, and are able to be cared for at home. But as our hospital volumes continue to decrease, the type of patient who goes on to have severe COVID still is very similar as that spectrum has been throughout the pandemic.
Another question around the vaccine, and I think this is a really important one. Is there any concern that people will start opting out of getting the vaccine since we still are going to be required to mask, social distance, and kind of keep up these same efforts as we had before? Is there any concern that that could be the case?
We sure hope not. These need to be looked at as complementary efforts. The vaccine and our infection control efforts work hand in hand in this race against those variants of concern becoming dominant. And one without the other won't be successful. So, our message to the community is that as these vaccines become more widely available, we have to look at the use of masking, the social distancing, avoiding gatherings as a very complementary practice that allow us to get back to a full return to normalcy as quickly as possible. And if we let one slide, we'll be relying entirely on the vaccines as a tool, and they'll come up short.
I think that's really important to note too. If you have family members or friends that currently fit within that eligibility, which is right now 70 plus, and then K through 12 educators, first responders, EMS workers, long-term health facility healthcare workers, that you should go encourage them to get vaccinated, help them out if they need help. There's lots of different resources from the local health department. And I think that's really important. If they're having trouble online getting an appointment, try to help them out, because like you mentioned, it'll be great to get those people vaccinated. And along those same lines too, is there any sense that we could move to the next group of people who are eligible sooner than that March 1st timeline? I realize that's in about 2 weeks, but is there any sense that it could happen sooner than that?
I don't think so. And the reason for that is that this is a fairly large new group that we're expanding into. And it's a group where we have to get the word out to those patients so that they know that they qualify. And we also need to make sure that we have the infrastructure set up so that when we do go live, that there aren't hiccups with backups and lines and drug availability. So I think getting the pieces in place and doing it in the right way in the long run will actually be a wise investment, because when we do go live and expand to this next tier, we want it to go as smoothly as possible. And we recognize that this is a group of patients who have chronic medical conditions, whose access to healthcare is a really important part of their life. And from the Intermountain side, we're looking forward to working with the state to try to make this as smooth a process as possible.
And if you wanted to know about that eligibility as well, the Utah State Coronavirus site has a lot of great resources. I'll post the link afterwards for people, but it explains what serious medical conditions qualify for that March 1st round, and also the 65 plus age limits. One other question for you around the vaccines. Are you okay to take a pain reliever or some sort of medication after you get your second shot if you start experiencing any sort of side effects?
Yeah, that's a great question. There is some suggestion from other vaccines that using Tylenol or ibuprofen, especially after the first dose, might decrease the effectiveness of the vaccine, but that evidence isn't extremely strong. And so, the general guidance is that if you do have body aches, chills, fever, first, those are very normal. Those are not side effects. Those are expected effects that indicate that the vaccine is working, that it's doing what it's intended to do. But those are also symptoms that are, uncomfortable. And as somebody who's had the second vaccine, I can tell you right now, I had a second day after that second dose that I felt pretty crummy. And it's safe. As long as you don't have any other liver or kidney issues, it's safe to take Tylenol or ibuprofen if you need it, especially after the second dose.
So you just mentioned that those side effects or the effects that you're getting is because of your immune system. If nothing happens to you after your first or second dose, does that mean something one way or the other?
No, and don't be disappointed if your friends are all feeling awful after the second dose and you don't. The genetics of our immunity are very complex and everyone's built a little bit differently. And so the absence of having those symptoms doesn't mean that the vaccine's not working. But if you do have symptoms, you should know that it's not because you have COVID, it's because of those symptoms are because the immunity is being built in your body.
Some people have also said along those same lines that the way you react to the vaccine could have been the way you reacted to COVID-19. Is there any sort of data behind that, or is that kind of just a rumor that's floating around there?
Again, it's so variable. I think that's more anecdotal. The vaccine, in some patients who had very mild COVID-19, the vaccine may very well generate a more robust, a stronger immune response, and that's actually what we're hoping for. We want the immunity from the vaccine to be stronger than the immunity that we get from a mild case or an asymptomatic case of COVID. So there may be some differences in how you respond to the vaccine with respect to how you responded with acute COVID.
So don't stress about that either way, it sounds like. Someone has another question around testing positive. Is it possible to test positive for COVID-19 after you get the vaccine if you do not actually have COVID-19?
Very important question. The current tests, both the PCR tests and the antigen, which are also known as the rapid tests, are both designed so that they have no cross-reactivity after vaccination. In other words, if you test positive by the PCR, it's detecting the genetic material from the SARS-CoV-2 virus in your body, and that genetic material is not stimulated in any way by the vaccine. So if you have a positive PCR test, you unfortunately have COVID. And if you have a positive rapid antigen test, those rapid antigen tests also do not detect the spike protein, which is what the vaccines stimulate your body to create temporarily. So the same thing applies. The rapid antigen tests are also not falsely positive after vaccination.
That's good to know. And I think that's really important when people go to get the vaccine to consider the differences if they do end up testing. Last question for you. Do you expect case numbers to continue to decrease throughout the state? And what is going to be the biggest factor going forward that could potentially derail that progress of moving down?
Yeah, I do expect them to continue on the trend we are in right now. The two threats to that are if we abandon our efforts too early, if we give up doing the things that we're all tired of but are still very important before we have achieved enough community population level immunity. And second, these variants are called variants of concern for a reason. We are concerned and cautiously watching them. If these variants become dominant, especially the UK variant, which appears to be most common in the US of these variants, if one of those is able to become a dominant feature and outcompete the current strain, that could cause our case numbers to go up again. And we need to be aware that that is a very distinct possibility.
So it sounds like taking these public health measures, getting vaccinated when it's your turn, can really help us kind of continue on this trajectory of getting back to where we were in 2019. Do you have any last words for us on anything that you'd like to say for this week?
Yeah, I think everybody should feel good about the efforts that the community is doing as a whole, and look at this as a race between the vaccination and continuing to do the right things to finish strong against the possibility of these variants. And we want to win that race. We want to limit the number of transmissions in the community so much that even if the variants do emerge in our community, there just isn't enough transmission for them to become a problem.
Well, Dr. Webb, thank you so much for joining us. I really appreciate the time. And if you have any questions around COVID-19 testing, you can go to intermountain.com/COVID testing. You'll fill out a brief survey to see if you qualify for a test, and then you'll be able to select an appointment arrival time. I will also throw that link for the vaccination distribution timeline and the serious medical conditions into the live afterwards, but it's a great resource to find out, or your local health department is another great resource to find out when you can start scheduling those appointments. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. It's a free support service for the community, and that phone number is 833-442-2211. Thanks, everyone. We'll talk to you next time.